Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. Today, let us talk about liver. We keep talking about fatty liver, we keep talking about alcohol affecting the liver. Why don't we talk about the common infections of the liver? Hepatitis is what I'm going to cover today. So, this hepatitis is caused by various viruses. There is hepatitis A infection, hepatitis B infection, hepatitis C infection, hepatitis D infection, and hepatitis E infection. These are the common ones. So, to talk about, let's just go in the order. Hepatitis A infection is majority of the time caused by fecal-oral route, though sexual transmission and bloodborne is very rare and we can say almost negligible. So I will be concentrating more on the fecal-oral route. So it is basically foodborne infection. So you have to make sure that your hand hygiene is well maintained. This is majority of the time acute. What do I mean by acute? You had food outside, in a week or two, you develop the infection, you will have jaundice, you will have fever. The course would be for about a week or so. How are we going to prevent it? Well, hand hygiene is very important. And of course, whenever you pass motion, you have to make sure that the fecal-oral contamination does not occur. In general, every time you use your washroom, it is better to wash your hand with soap water. And even before you eat your food, you make sure that you are washing your hand with soap water. As much as possible, have cooked food. Whenever you're drinking water, make sure that the water is properly boiled, cleansed, and even the water sources, make sure that it is clean. Whoever is the food handler, the one who cooks at your house, if they are sick, kindly tell them to take rest and one of you take over. Thereby, we can prevent the infection from occurring. So you would be presenting with jaundice, you would be having fever, tiredness, vomiting feel, you might be losing your appetite. These are the common features. Majority of the time, it does not require treatment. It is self-limiting. All you need to do is supportive care, like healthy food, adequate fluid. If you have fever, temperature control with paracetamol, all these supportive care. Let's say you have too much of loose motion, then oral rehydration, giving you probiotic, all these things would help. Next is hepatitis B infection. Hepatitis B infection is mainly because of any blood infection. What do I mean by any blood infection? Even if you are getting a tattoo pierced, even if it is through the shaving blade, it can occur. Nose piercing, ear piercing, any of these things can cause. Even a small blood contamination can cause. It can be transmitted sexually. It can be transmitted from mother to child. These are the common modes of transmission. How are we going to prevent it? Of course, by using sterile needles. Whenever you're giving a blood donation or something, make sure that there is no contamination. If it is, whether it's a sterile environment, whether it's a fresh pack that is open for collection. If you're getting transfused, make sure, anyway, these days in hospitals, we make sure that it is not contain hepatitis B. Okay, so we screen it and we give you. So if you're at the receiving end, majority of the time, it is not a problem at all. Actually, even when we are collecting the blood from you, we make sure that the environment is sanitary. Despite that, we do see in cases of IV drug abuse, we see in people who have multiple sexual partners, we see in people who tattoo, who pierce, and those who are sexual workers, etc. So, how can we prevent this? Well, you can prevent it by taking the hepatitis B vaccination. Especially if you are a healthcare worker, you are more prone to it. Even if you're a barber, if you're someone who is doing the tattooing, you are also at risk. So make sure that you are well vaccinated. Let's say that you have already exposed, you're infected. In that case, we will be giving you something called as immunoglobulin to prevent the infection from progressing into a disease. So hepatitis B can be treated. We will be investigating it By doing hepatitis B core antigen, we will be checking the viral load, we will be typing, we'll do battery of tests, and we will decide whether you need treatment or not. When you require treatment, we will decide based on the report how long the treatment has to be given. When it can be prevented, it is best that we vaccinate ourselves. When I'm talking about hepatitis B, I would tell you about hepatitis D as well, because hepatitis D occurs only when hepatitis B infection is there. So if you prevent hepatitis B infection with vaccination, hepatitis D would naturally stop. The same modality of transmission occurs for hepatitis D. It is a dependent entity, it can never occur alone. Coming to hepatitis C, again it can be transmitted because of the blood products, because of sexual contact, etc. So here this can be more virulent, but these days we are seeing a decline in cases of hepatitis C, but it is better to take care of yourself, follow the preventive strategies that I had mentioned for hepatitis B. So if you are infected, again we will be giving you the treatment and we will be curing it. Coming to hepatitis E, it is mainly again fecal-oral mode of transmission, that is through the food. So once you maintain food hygiene, you can prevent this infection. Hepatitis E is very dangerous in pregnant women. So that is one of the main reasons we tell pregnant women to go for homemade food. What all can cause a fatal condition because of hepatitis infection? Well, you can have a fatal episode with hepatitis B, with hepatitis C, if you are a pregnant woman, with hepatitis E as well. But as compared to hepatitis A, hepatitis E in general is much more safer otherwise. So when anything that can be prevented, it is best that we follow the preventive strategy rather than waiting for it to become an active infection and cause a disease. I hope this video was useful. I would request you to follow me for many more videos. Thank you.